Hello, and welcome to the Hawaii Health Data Warehouse's Coffee Break monthly webinar series. I am Ashley Yamanaka, Public Health Epidemiologist with the Hawaii Health Data Warehouse, or also known as HHDW. We're going to use the next 30 minutes to go through an overview of the hhw.org website and its data sources. It will be the perfect introduction if you are new to the site or a good refresher for returning users. So for those of you familiar with the Hawaii Health Data Warehouse, you'll know that we use two different websites to accomplish our goal of making public health data for Hawaii available in user-friendly formats. If you joined us before for a coffee break last month, you saw our Back to Basics introduction of our hhdw.org website. If you missed it, check it out on our YouTube channel for the video. Today, we're going to focus on both websites, HHDW and HHM. And so now we're going to start with the two main parts of the Hawaii Health Data Warehouse. The first site is Hawaii Health Matters, which is also known as HHM, and it was created in 2009 through a contract with Conduit Health Communities Institute. It displays Hawaii data for over 800 health indicators from dozens of different data sources to provide local data in an easy-to-use format. The indicators can be presented in trackers and shareable dashboards, and the platform also houses reports, promising practices, and funding opportunities. All of these sources are linked to the health indicators so that the data is presented with a bit more context. The site focuses on context to help us understand the story behind the numbers. This is a great site for people who might want to learn more than just the numbers. On HHM, you will find data from a wide range of data sources, both nationally and locally. National surveys like the US Census, Immunization Survey, and National Children's Health to local sources from state-level partners such as the Department of Education, Department of Health, EMS and Injury Prevention, Department of Human Services, MedQuest, La Lima Data Alliance, and much, much more sources can be found on this site. HHM aggregates a broad set of indicators so our communities can see how we're doing across social, health, and environmental dimensions. If you are interested in seeing how Hawaii is doing compared to national averages, this would be the site for you. The second site is hhdw.org, which is more of the technical side of our data warehouse. It houses reports, topic pages, and an interactive build your own report tool. It pulls from 6 major data sets. These are curated and maintained to ensure data quality. HHDW brings together key population-based data sets collected through the Department of Health and National Surveillance System. These include the Behavioral Risk Factor Surveillance System, Pregnancy Risk Assessment Monitoring System, Youth Risk Behavior Survey, Youth Tobacco Survey, and Vital Statistics for birth and death records. Together, these data sources paint a full picture from health behaviors in adults and youth to maternal and infant outcomes. This is a great site if you're interested in disaggregating data for specific factors or groups. You could also request record-level data from this site. This is one of the most important takeaways. Not every indicator comes from the same source or even measures things in quite the same way. If you knew where the data came from, you can interpret it correctly. Some indicators can't be compared year to year or across data sets. For example, both PRAMS and vital statistics give us information about pregnancy, but PRAMS tell us about behaviors like smoking during pregnancy, while vital statistics tells us how many births occurred. Both are right with their own context, but they answer different questions. Here's what happens behind the scenes of our website. First, data are collected through surveys, records, or registries like birth certificates, death certificates, or phone and school surveys. Next, those data are managed by Department of Health programs to verify accuracy and completeness. Then they go through processing, reviewed, cleaned, coded, identifiers removed, and small counts are suppressed. Finally, they flow into HHM and HHDW, where they become indicators, trends, and dashboards. So when you use the warehouse, you're seeing carefully curated information. So let's take a look at each major data set and what it covers. So for vital statistics, it tracks every birth and death in the state, perfect for things like birth rates and causes of death. Burfis focuses on adults, chronic diseases, health behaviors, and risk factors. PRAM surveys mothers shortly after a live birth so we can understand prenatal care and postpartum health. YRBS and YTS capture behaviors among youth, mental health, physical activity, and tobacco use. Together, these data sources complement one another to tell Hawaii's health history. This table shows how different questions map to different data sets. For example, if you want to know how many births happened, that's vital statistics. Every birth certificate is counted. If you want to know how many mothers smoked, you'd go to PRAMS, which collects self-reported behaviors. To know what percent of adults smoke, that would be Burfis. For teen vaping, YRBS. For deaths from lung cancer, again, you would go back to vital statistics. So choosing the right source is key. It helps ensure what we're trying to answer with the right question with the right data set. So this example illustrates why data sources matter. Vital statistics collects information directly from the birth certificate, usually completed by medical staff. PRAMS, however, asks the mother about her smoking behavior before and during pregnancy. Because PRAMS uses self-reported information and includes timing questions, it captures more nuance, while vital statistics might undercount due to stigma or reporting gaps. Neither data set is wrong. They just describe different aspects of the same issue. Understanding those nuances helps prevent misinterpretation. So where do you actually go to find this data? HHDW.org is where you can explore detailed data, multiple years, and even build your own reports. This is ideal for analysts and researchers. HawaiiHealthMatters.org is more user-friendly, great for community storytelling, grant writing, or planning with over 800 indicators and easy-to-read summaries. Together, they're designed for different audiences, but powered by the same data backbone. Before using any data set, here's a few tips. Check the data sources or About Us section to see where the numbers come from. Watch for suppression rules. Small counts are hidden to protect privacy. Understand your denominator. Know what population your rate is based on. And make sure you're comparing the same year ranges. If you're unsure, reach out to the profiles team at the email below, and we can clarify or guide you to the right resource. On the HHDW homepage, the data sources section is a great place to start to learn about the data sets we have available and to help you get started on your data interests. Here's an example of the PRAMS data under the data sources section. The top of the page provides an overview of PRAMS, a data release notes section for every year of data available, and a PRAMS report section that includes trend reports and fact sheets. Now, if we go back to the HHDW homepage, we're going to click on the Health Topics section. Each health topic in HHDW brings together data from multiple sources, and this is where understanding those sources really matter. Let's explore tobacco on the bottom right to find the data sources that drive this site. This is an example of what you'll find when you click into a specific health topic. For tobacco, you'll see an overview of the health topic and data from Burfis for adults, YRBS for teens, and sometimes YTS from past years. Each of these data sources has a different population, method, and time frame. When you're on this page or something similar like this, take a moment to check the data sources in the How It's Tracked section. That's where you'll see where the numbers come from and how they were collected. Along the right side of the tobacco page, you'll see several menu bars. The indicator reports give you ready-made summaries on tobacco with graphs and breakdowns by demographics. The customizable reports let you build your own tables and charts. Great if you want to focus on a specific group or time period. The How It's Tracked section explains how the data are collected and what each indicator really measures. So these menus just don't show numbers, they help you interpret them correctly and understand the sources behind each data set. On HHM's homepage, under the Resources and Tools menu, you can click on the related data links to learn more about the data sources behind the health indicators, indexes, and much, much more. So now let's do a quick activity. Think about which site or data source you'd use for each question. I'll give you a few seconds to think about this one. All right, so the answers on HHDW using Burfist data for the percent of adults feeling depressed, HHM under tobacco use indicator for teen cigarettes use compared to the national average, and then you would go to HHDW using birth data to look at low birth rates by Hawaii County. This shows the importance of knowing your sources and where to go. I'd like to invite you to join us in December for our next coffee break webinar on December 2nd at 11 a.m. We're going to go over social determinants of health in HHDW and HHM. Thank you so much for coming today. If you have any questions, please contact us at profiles@hhdw.org. We look forward to seeing you in December when we will be taking a closer look at the social determinants of health on HHDW and HAM. Mahalo and enjoy your day.